Does it have the presentation over there?
Yes, I see. Yeah.
Okay, Dr. Udekwe, can you carry on from your end? You've introduced us, so you can go on, and let me put on the first slide for you. And please let me know once you're done. You just let me know, and I would move to the next slide. Is that okay with you?
Okay, yes, thank you, Prof.
Very well. So carry on and let me know when you move to the next slide.
Okay, no, go to the next slide. I'm done with this.
Very well. Okay.
So, yeah, thank you very much, Prof. I appreciate this. In the introduction of this study, the health sector is regarded as a significant for economic growth and development, and the life of citizens is very important for the growth of any economy. So we kind of regard the lives of citizens as very important. So human resource management of the healthcare workforce is also very critical. So that's why we're looking at the human resource information systems, how it's being utilized to maintain the workforce in the health sector. So I'll first of all define HRIS is the mean HRIS, which means human resource information system, the system that is used to analyze, manipulate, and acquire human resource information in the organization. And numerous studies have shown that HRIS in the health sector has been conducted, yet identifying its influence towards workforce sustenance and availability is it's yet to be accomplished, because we can see the African continent, we are kind of going through migration of healthcare workforce to other developing countries. So the need for this study is very, very essential to assist us in monitoring and maintaining the skilled healthcare workforce, and to accomplish the SDG, Vision 2030. Therefore, a study of this kind is very, very important for strategic imperative towards strengthening the healthcare workforce for delivery. So the study explores on the HRIS influence in the healthcare sector in the Western Cape of South Africa. So next slide, please.
Very well.
So we have a literature review which we did, and identifying some literatures and the gap in literature on this study. With several studies have highlighted the use of outdated information systems to manage health records of healthcare workforce, which also compromise the secrecy of workforce details. And confidentiality of health workforce information is significant due to its sensitivity, which requires an effective information system, HRIS. And the scarcity of health workforce, I've mentioned before, the migration of health workforce from Africa to other continents and other developing countries has been a problem which African continent is facing. Also the use of manual HR system in most African countries, healthcare system has been a challenge which affects the continent. Then we looked at the functioning. The need for effective HRIS system is very, very essential, and towards achieving the Sustainable Development Goals Vision 2030. And there's a gap in research which highlights how HRIS could influence healthcare workforce sustenance and health sector performance. Prof, next slide, please. Prof. Chux, next slide, please. Yeah.
You've got it
now.
Yeah,
thank you very much. Now, the methodology that we applied on this, we have applied mixed method, where 4 hospitals were involved. 87 participants were involved, purposely selected for the study. We had 46 questionnaires and 41 interviews, because this study was conducted during COVID, which was a limitation to the study. But in any case, the quantitative was conducted just through questionnaires, analyzed through SPSS, and the qualitative was conducted through semi-structured interview, transcribed, analyzed using Atlas TI. Adaptive approach with a multiple case and survey research strategies were followed. The descriptive and exploratory research design was initiated in order to gain an in-depth knowledge of the factors of the influence of HRIS in the health sector. We did some property testing on the validity of the data instrument. Questions were drawn from the gaps in the literature, and the study approvals and ethics clearance were obtained from the Department of Health of South Africa and the University of in South Africa. Prof, next slide, please. Prof, next slide. Prof, next slide, Professor Chux. Prof, next slide, please. Yeah, thank you, thank you. So this is a figure that showed the qualitative participants. We had 41 interviews conducted, which is 47% of the participants. Which we had the highest are the nurses were the highest, followed by the medical doctors and the pharmacy department, and the HR and admin were also part of it. We had a 22% people from different departments like the radiography, community service, social workers, occupational therapists, lab technicians, and so on. They all participated in the study. So the next slide, Prof. Next slide, please. Professor Chux.
Yeah, I've put on the next slide already. Can't you see it? Figure 2.
Okay, thank you. Yeah, thank you.
Can you see it?
Yes, I can see. Thank you.
Okay, good. Go ahead.
So this is the quantitative participants. We had 46 questionnaires because the study was conducted during COVID, so we couldn't. COVID affected the data collections strategy, which that's why we only had 46 questionnaires. But in any case, we went ahead to analyze the data, to conduct the study and analyze the data, coupled with the question interviews. Prof, next slide, please. Next slide, please, Prof.
Yeah, I'm also okay. Is that okay?
Thank you. Yes, thank
All right.
you. So the qualitative data was analyzed through the Atlas TI, and the system gave us a summary of the response from the interviews, where we looked at lack of HR knowledge. We looked at HRIS used in the health sector, the ESS and MSS models, if they were actually being used, and the system. Also, we looked at the HR departments, HR units, traditional HR in the system, in the usage in the health sector. We looked at the communication structures, looked at the size of the hospitals and how it impacts on HRIS effectiveness in the health sector. We also look at the security information, security of information, of health workforce information, how secure it is in the health sector, because most of the hospitals that we conducted the study with, they did not make use of HRIS system. They kind of used the traditional system to conduct the HR management system. We also looked at the training, because most hospitals were not technically advanced to allow most of their workers to have access to the system. They were conducting the HR management manually and traditionally, and this is in the health sector, so which was also a challenge. So, Prof, go to the next slide, please. So this is the quantitative and study. This is the analysis. This is the summary of the quantitative. These are the questions that were portrayed, asked, and the response. You can see from the response, the first question, HRIS for strategic decisions, where 50% did not give us neither agreed response, although 28% disagreed, because the system they use is not automated to allow decisions to be made through the system, like to identify where a health practitioner is needed to and to be employed at. So that's why most of the times some hospitals are lacking healthcare practitioners, because once people resign, there's no one they cannot identify people to replace them. We look at the security, then we realize that although most of them agree that there should be security in the HRIS system, because there is security codes and passcodes that users use to log in, but where there is no HRIS system, where most hospitals are running the HR management manually, that creates a security mishap, security blunder, where most information can be misled, can be misplaced, or people have access to information that are not supposed to be. Then we look at the size of the hospital. Most hospitals are very big. They have over 150 employees. Yet they don't have an HR department. They don't have HRIS system. Since things are done manually, which is also a challenge. We look at internet access. Hospitals, they have access to internet, but workers don't have access to use HRIS system. They do it manually. We looked at liaison manage. Is there any system in place where people, employees, professionals can liaise with management through a system? It was not there. They lack it. Then also we look at customized HRIS system in the health sector, public South Africa. They agree that there's a system. They use something like a parcel, which is a HRIS system, but not all hospitals have access, and not every employee can access it, which was identified as a challenge. Knowledge and awareness of system. Most practitioners that were interviewed, that participated in the study, were healthcare practitioners, which of course means that they do not have an idea of what HR system is in place and what HR system that is being used, which requires knowledge and training, which they lack training and knowledge and the cognizance of what HRIS is used in the health sector. Prof, next slide, please. Next slide. Thank you. Then in the discussion, where we had to bring in the findings and we relate with literature, where we look at deficiency of knowledge and awareness of HRIS system in several healthcare practitioners, among several healthcare practitioners in the health sector. We relate the discussion with literature, similar HR practice, but not everyone have access. They have a similar HRIS system, which is parcel, but not all the healthcare sector have access to it. Non-availability of HR department in most hospitals. They have a big hospital that's 24 hours, but they don't have an HR department. They don't have HRI access. Everything is done manually, which is also a challenge. Yes, manual HR practice, as I mentioned before, which also creates insecurity of information and documentation. Then the magnitude, which means the size of the hospital. How does it impact in the effective HRI system, where some hospitals are big, but they don't have an HRI system, they don't have HR department? It's a challenge. How can HRIs influence communication among the authorities? Is there any system in place where health practitioners can relate with the authority? They don't have that in the system, which is such a challenge. Cross, next slide, please. Then this is the framework that we are able to come up from the study, where we look at the influence. Security, as we mentioned before, security was an issue because most hospitals are manually run their HR departments manually. HR department is lacking in some hospitals. They have customization of a system. They need a system that is customized, where all workers can have access through a system, through their portal, through their phone. It's lacking in the health sector in South Africa. Communication, no system that workers and the management can easily communicate with, and the strategic decisions are not made through an information system. It's probably made through manually or human ideas. Then the size of hospital is also part of what was identified in the study, which is an influence, which of course requires a proper training, proper automation of processes, and proper funding for us to have an effective HRIS system in place. Next slide, please. In conclusion, HRIS can significantly influence health or workforce sustainability in the health sector. The study highlighted several reasons which is HR influence, such as absence of knowledge and awareness, absence of HR department, insecurity of manual system, workforce access, lack of workforce access to HRIS system, lack of the strategic decisions through the system, lack of IT infrastructures and automation of systems in place in the health sector, insufficient funding, inexperienced HR staff, and poor management structures. This will require technological automated system for effective HRIS, and also government to invest highly in systems such as HRIS for strategic decisions. And we have few recommendations, which means to educate and train the healthcare workers on HRIS automated system and to enable them access to, and also discourage manual HR functions. Government, healthcare management and workforce must embrace support transformation in the sector, upgrade the current HRIS with advanced technology and AI-based processes for workforce access, irrespective of HR department and size. We need to have a similar HRIS system like Parcel or a system that is similarly used in the public health sector in the country, so that we can easily track and identify healthcare practitioners anywhere they are, so that whenever we lack a skilled healthcare workforce, we can easily identify someone else somewhere to replace them. Also, we employ qualified HR practitioners to operate the HRIS system. Next slide, Prof. Next slide. Yeah, we had a limitation. The study was conducted during COVID, which was a limitation. For further study, we need to further conduct the study to include more hospitals and in other provinces in South Africa to identify the relevance and implications of not having an AI-based and technology advanced HRIS system for skilled workforce retention in the health sector. Next slide, Prof. Yeah, these are the references that were cited. Next, all the references that were cited in these slides. That's the end of my presentation. Thank you very much.